Hello, everyone. Thank you for joining me. I'm so happy to have you all here. Today, we are going to learn about sexual health made easy, simple tips, and the structured approach, and some example cases. And then I will show you around my CSA SmartSuccess online program. And then we will see example cases in detail, right? Let's start. So you will learn how to make the best impact by your consultation style, how to navigate the difficult sexual health questions, and how to build the rapport quickly, how to establish your authority without appearing bossy or doctor-centered, and how to boost your success rate in exams with confidence, and how to manage some of the example case scenarios. And who am I? I'm Dr. Hamer, one of the GPs in UK. I'm here to help you to pass your exams with flying colors. First of all, we should know how our consultation style impact our results. Being a GP is about more than knowledge. It's about having excellent communication skills and being able to make a diagnosis at initial presentation. And that is what the CSA has been designed to assess. This is according to our RCGP chair, former Professor Ms. Jarada. And in UK, the MRCGP CSA exam costs around £1,000 per sitting. So we have to be very cautious. It is a challenging and comprehensive examination. And good consultation results is a win-win situation for you and your patient. Failure in it causes huge psychological and financial burden. My aim is to train you so that you can rock your consultations and pass your exams with flying colors. It is very important that you start preparing for it as early as possible. These are the 3 domains you need to know to boost your success rate with confidence. They are data gathering, technical and assessment skills, clinical management skills, and interpersonal skills. Let's see each one in detail. In data gathering, you should gather the data and use them for clinical judgment, choice of your examination, investigations, and their interpretation. You should demonstrate proficiency in performing physical examinations and in using diagnostic and therapeutic instruments. In clinical management skills, this will establish your authority without appearing bossy. So we have to recognize and manage common medical conditions in primary care. You must demonstrate a structured yet flexible approach to decision making and demonstrate the ability to deal with multiple compliance and comorbidities. And you must demonstrate the ability to promote a positive approach to health. In interpersonal skills, this will help you to build the rapport very quickly. Please demonstrate the use of recognized communication techniques to gain understanding of the patient's illness experience. Develop a shared approach to managing problems. Practicing ethically with respect for equality and diversity issues in line with the accepted codes of professional conduct. Let's see the features in detail of passing candidate and a failing candidate. In general features, the passing candidate will be fluent, interactive, and very relevant in his history. He or she will be able to take patient into medical world as a shared partner. You have to be open about lack of knowledge or certainty and may use this constructively in your consultation. You have to actively monitor during your consultation. In failing candidates, they poorly use their time. They are uneasy with or unable to acknowledge their own ignorance or uncertainty. They will use more scripted summary than checking understanding. They are unaware of personal space. While the passing candidate will take a focused history that includes all relevant information and they embed the questions in previous response. A failing candidate will have a formulaic questioning which can become interrogative. They will use repetitive questioning and sequence of questions does not make sense. In clinical management, a passing candidate appears knowledgeable and refers to recognized algorithms or modes of practice. And they will be able to suggest solutions to problems or a range of reasonable management options likely to be agreeable to patient. A failing candidate will be insufficient in their knowledge base or ability to think of realistic and effective alternatives. They fail to integrate and apply the knowledge. They put off making clinical decisions or a clear diagnosis. They don't appear to grasp the dilemma if there is one. In interpersonal skills, a passing candidate connects instantly with patient. They are non-judgmental, they are interested in the patient, they reformulate explanation using helpful metaphors and can meet patient halfway, picks up patient's agenda, accent, or cultural approach. While a failing candidate may be doctor-centered, patient's concern may not be addressed, they might be patronizing, will be unable to explain effectively, may be wrong or not tuned to patient, inappropriate use of terms, they might be over patient-centered to the detriment of clinical outcome. Now, let's see the ways to improve your technique. Given the more challenging CSA mark scheme, we recommend that trainees start practicing for the exam earlier on. Understand what exam is testing and read through the RCGP CSA feedback statements and examiners' suggestions on how to improve on each one. Many trainees only read this if they fail the CSA and are preparing for a reset. If you can learn what makes people fail, you will know what to avoid. Set up a study group with other trainees and try to practice cases regularly, perhaps once a week from the end of your ST2 year. Try to do joint surgeries with your trainer so you can get feedback on both the communication and clinical aspects of your case. Try to do some video surgeries. You will need to enlist the help of your practice team for this to work effectively. Ask the receptionist to let your patients know that you're videoing as part of your training and ask for a consent form to be signed if they are willing to take part. Make it very clear to patients that these videos will never be used for anything other than your training and they can change their mind at any time during the consultation. Watching yourself on video or going through them with your trainer often helps to pick up communication issues that could otherwise be missed. Join a course as early as possible. RCGP runs courses all over the year and eMedica, CSA SmartSuccess. Yes, join us in CSA SmartSuccess. We will be happy to help you to pass your exams. Exploring the sexual history of a patient is an essential part of your success. Without it, the chance of addressing an STI risk could be missed, and so could your chance of passing. Let's see some general tips. Please ensure confidentiality. Be open-minded and be non-judgmental. Please always put the patient at ease. Be aware of your own body language, gestures, and posture. Maintain eye contact. Explain why discussing sexual history is relevant in that particular case. Look out for subtle nonverbal cues from the patient. Promote good sexual health. Another crucial consideration is the issue of child protection. An on-call team can be referred to if necessary. Consider safeguarding issues for vulnerable adults. Remember, a sensitive approach is needed for sexual assault victims. Let's see some example structured approach. Feel free to change the words you're comfortable with. I would always ask, when did you last have sex or sexual intercourse? As STIs have incubation and window period. Question number 2, was it with a man or a woman? Because TB is common in women and LGV is very common in MSM. Question number 3. Was the person a casual or regular partner? Because the risk varies with the exposure rate. Question number 4. Where was the partner from and what is their ethnicity? As you know, some of the ethnicities like Afro-Caribbean, Mexican, they have a higher risk. Question number 5. In which country did they have sex? Countries like Africa, Mexico, Thailand have higher risk. Question number 6. What kind of sex did they have? It guides which tests are needed. Example, blood test or swabs. Question number 7. For each type of sex, whether it is oral, vaginal, or anal, did they use a condom? For heterosexual sex, was any contraception used? Relate to the risk of pregnancy when asking about last menstrual period in gynecology history. Assess whether they were the active insertive partner or passive receptive partner as appropriate. Question number 8. Does or did your partner have any symptoms? Question number 9. When did you last have sex with someone different? So when you enter question number 9, for each person, you have to go through all the questions number 2 to 8. And repeat this for all sexual contacts in at least the preceding 12 weeks. And my humble tip, never assume the sex of previous partners. Trust me, I have made that mistake many times before. It will be a costly mistake if you make it in your exam. For men who report recent sexual activity with women, it might be useful to ask if they have ever had sex with men in the past. Question number 10. Have you ever had any previous STIs? Any previous drug allergy, drug resistance, etc. can be noted. Question number 11. Have you ever had a sexual health checkup before? Question number 12. Have you or have any of your sexual partners ever injected drugs or shared needles? For women, have you ever had sex with a gay or bisexual man? For men, ask about any history of sex with men as per point 9. Question number 13. Have you ever had an HIV, hepatitis, or syphilis test before? This will help us to assess the risk and offer tests as appropriate. Question number 14. Have you been vaccinated against hepatitis B or have you ever had hepatitis? Assess the risk and offer vaccination if appropriate. Example case scenarios. Okay, so join us in CSA SmartSuccess if you would like to. I would be happy to help you to pass your exams with flying colors, right? So I will leave a link below to join us. And if you join, if you're the one in 10 candidates, if you join us, you will have so many opportunities to explore. And I will personally help you to tune your consultation skill. Situations in which there may be reasonable cause for concern in relation to child protection. So you have to be very cautious. Candidates need to be aware of the details of child protection guidelines so that you can provide safe assessments of the problems and offer correct advice. Young man asking for sleeping pill might be worried about his recent sexual intercourse with a prostitute at Thailand. Or any man with the UTI symptoms but with negative urine analysis, we have to think about sexually transmitted infections. We must promote good sexual health and provide education to the patient whenever we have the chance. Any women with lower abdominal pain or UTI symptoms must be at high risk for STIs like chlamydia. Young girls requesting contraception may be at risk of sexual abuse or rape or pregnancy. So we have to check them. Please check competency in kids. Understand the principles behind Gillick competence. If a child is not Gillick competent, the parents or those with parental responsibility must authorize treatment on the child's behalf. If a Gillick competent child refuses consent, this will not necessarily override authorization given by someone with parental responsibility or the court. However, Such authorization means treatment could be undertaken against the child's wishes. In deciding whether a particular treatment is in a child's best interest, a doctor needs to consider the consequences if the child's condition is left untreated and also the impact of imposing treatment on the child. Doctors should also bear in mind in child's age and emotional development and the nature and possible consequences of the proposed treatment. Gillick competence can be applied generally to any patient aged under 16 who is judged able to consent to treatment. GPs need to decide on a case-by-case basis whether the child is Gillick competent and always discuss involving parents in decision-making. If in doubt, it is advisable to seek advice from your medical defense organization before proceeding. That's it. Thank you so much. Please go through these example case scenarios and practice with your colleagues, your trainers. Join one of the courses and be prepared. Rock your consultations and be successful. Thank you so much for joining me. Please visit www.CSASmartGroup.com for more articles like this. And remember to join us in CSA Smart Success if it resonates with you. I will show you how it looks like in CSA Smart Success. Yes, this is the CSA Smart Success page. It's an online program mainly to empower doctors to rock their consultation. So this is the home page you're seeing. And we will have my video there and it will explain what to do. And we have got so many programs, so many sessions for you to go through. And we have got all the topics covered, like cancer and palliative care, cardiology, older people and renal diseases, digestive, metabolic and hematology, ENT and ophthalm, dermatology, ethics, values and legal cases, genetics, men and women's health, mental health, alcohol and substance misuse, that is my favorite, pediatrics and immunology, rheumatology and musculoskeletal, and one of my other favorite subjects, sexual health and infectious disease. So all these topics are covered. And in each topic, we will go very detailed with all the cases you need to know. And each individual topics will have all the most common topics you need to know. So in STI, you will come across all these cases in detail. You have videos, you will have a PDF. And in addition to this, I have got so much of bonus content and masterclasses and webinars. You will have masterclasses on palliative care made easy, sexual health made easy, genetics made easy, difficult communications made easy, substance misuse made easy, men's health made easy, women's health made easy, diabetes made easy, dermatology made easy, musculoskeletal made easy. These are some of the master classes, and we have webinars as well, which will be added. Mindset Magic. And then you will have some bonus content to go through, like my ebook, what patients really expect, 6 smart success steps to your CSA success. Many of you might have got my Rock Your CSA free training. Please feel free to visit my website, www.CSASmartGroup.com, and you will find a link to access these videos. It's a 3-video training series. Then I will give 10-day challenge to focus your consultation skills. There is a 6 smart steps to your success and a personal guide to your success and sharpen your consultation. And there are some other must-watch videos to tweak your mindset. So that's it. And then with the support, we'll have a Facebook secret group mainly for our students. You can post your short videos. You can get accountability and mentoring group. I personally help you and give my thoughts how to improve. And in support, you can get my one-on-one Skype sessions, which is damn cheap when compared with other courses. But I'm very restricted, so I take only few students every month. So if you become one of our members, it's only £100 for 1 hour personal one-on-one 6 cases. So it's very interesting, isn't it? It's how you practice, how you train yourself to kick ass and pass the exam wherever you are globally. I have got students from US, I have got students from Australia, Middle East who are appearing for MRCGP International, Australian GP exam, and I find more common things are common, but common sense is not a common practice. So it's very important to train ourselves, right? Please, if you're not resonating with CSA Smart Success, that's fine with me, but find somebody who is experienced in their consultation skills, like your trainers, your senior GP colleagues, your friends who have already passed the exam, and make use of their experience and practice all the cases which could come. And I pray for your success, right? You're in my heart, and I'm here to help you wherever you are in the whole world. And online makes it easy to access. And thank you so much. And I will leave the link to join the CSA Smart Success if it resonates with you. Okay. Thank you, guys, and see you soon in another webinar. Bye-bye.